Okay, Assalamualaikum and hello everyone. My name is Nur Syahra binti Othman. I would like to say thank you to all pioneers willing to come and listen to my presentation. Today, I would like to share my topic about risk management plan by service provider for clinical waste and healthcare. Okay, first of all, I will introduce of my topic, research background, my research problem, my aim, objective and research question, my scope and limitation, research significance of research, my research methodology, my analysis, finding and discussion, and lastly, my conclusion. Okay. My focus area is on risk management plan, service provider and clinical waste. Every year, there are at least 3 million cases of preventable death in the global healthcare system caused by various types of risk. To mitigate this issue, more hospitals are working to improve their risk management plan. Risk management plan is the process started by creating a team of stakeholders across the organization to review potential risks to the organization. The benefit of having a risk management plan are such as having valuable resources like time, income, asset, people and property can be solved if fewer claims occur. The importance of combining risk management plan with the clinical waste has been revealed. Mistake could happen anytime during the process of care. If can consider in a scenario where something break or come across technical issue in the dead of the night, the service provider can fix the issue. Okay, clinical waste generated from the hospital need a comprehensive and coordinated management. Hospital realize that they need manager trained in the area of the risk management plan and familiar with the healthcare practice to take care of such risk, as healthcare is a complex, regulated business that needs specific skills such as service provider. Okay, then I identify the problem. The major problem is risk management plan are up not to the standard. Risk management standards have been developed by the several organizations. These standards are designed to help organizations identify specific traits, assess unique vulnerability to determine their risk, identify ways to reduce this risk, and then implement risk reduction effort according to organizational strategy. The process from the team risk management plan are up not to the standard, which is lead to the major threat of environment pollution. Risk management plan is derived from the law and professional standard and is expressed through institutional policy and standard operational procedure. Then, second problem is lack of making risk management plan in clinical waste. Misunderstanding about risk management plan among staff about clinical waste management always occur. For the healthcare staff, they still make mistake in segregation of clinical waste. There is no awareness from the staff. Even though training have been given, their self-awareness still considered as low. The risk can happen if the waste is not in good handling because of lack knowledge from the staff about risk management plan in managing the clinical waste. Then lastly, a lack of risk decision making structure and lack of accountability for risk decision in an organization. In many cases, big risk decisions are being made too low in organization, with people who are not incentive to make the right decision for the organization. Having an understanding of the various risk management plan in clinical waste management, relate consideration and decision involved, and incorporating them into planning, and help expedite the clean up process and help minimize costs during an incident, enhancing community resiliency. Okay, then the aim of the research is to find the appropriate significant plan in the risk management plan among service provider for the clinical waste and healthcare. So to obtain the aim, 3 objectives was identified. Okay, firstly, to identify the process of risk management plan among service provider for clinical waste and healthcare. Then second, to investigate the challenges in handling risk management plan in managing the clinical waste by service provider. And lastly, to analyze the key factor in improving risk management plan by service provider for clinical waste and healthcare. Okay, then my scope and limitation. This research focus on risk management plan, service provider and clinical waste. Due to the main problem, risk management plan are up not to the standard. So the study only focus in generally to the risk management plan that concentrate to focus process, challenges and factor in improving the risk management plan. This research not describe the detail of process risk management plan. The study also we focus toward investigating the significant plan of risk management plan in the selected service provider in Malaysia which is focused in Klang Valley because majority of the service provider company located in Klang Valley. Then, for the service provider, management of healthcare with scientists, experience and expertise in servicing the public and private healthcare sector. There are too many of service providers in Malaysia, but only 4 service providers have been chosen for comprehensive analysis in this study. The service providers that have been chosen for this study are Redecare, Medivest, Flora Sentosa, and lastly medical apparatus supplies. And this study will focus on the clinical waste and how the service provider that have been chosen manage their clinical waste and healthcare. Okay. For the significance of research, this research could provide valuable knowledge that may assist to improve the risk management plan by service provider for clinical waste in healthcare Malaysia. This study will help hospital management and stakeholders in understanding the risk management plan in their organisation. The interview season will determine the appropriate significant plan in risk management plan in the organisation. The finding will show the hospital performance and can be used as guide to strengthen the area of weakness. The finding from the study will help the FM industry and stakeholders to understand the risk management plan by service provider for clinical waste in healthcare. There are several valuable benefits expected by the study. One of the benefits of the study, it can increase of awareness among the healthcare industry players to responsible deliver by focusing into the aspect. Okay, then for the research methodology, my first phase is identification of problem and followed by the data collection. I use qualitative research approach. Interview question was developed based on the factor found from the literature review and based on objective for qualitative data gathered. While the data, secondary data is from literature review, academic journal and others. Then I analyze the data by using semi-structured interview and case study to elaborate on each objective. My strategy in using the literature multiple case study approach to get the comparison and looking for the relationship of all case study and match this similarities pattern to confirm and analyze the finding. And lastly, I conclude and recommend of the establishing of purpose improvement and further research. Okay, then this is my analysis and finding. First of all, I actually looking for the hospital perspective, but when I'm trying to get the data from the hospital since currently MCO due to COVID-19 pandemic crisis that enforced until recently, I was not given permission from the hospital and they advised to go service provider's perspective. This is because service provider is more expertise in risk management plan in handling clinical waste. Service provider is more specialist in the risk management plan. After the MCO, maybe future study can do research on hospital's perspective. This is my respondent overview. Respondent 1 is for the case study 1, respondent 2 is for the case study 2, respondent 3 is for the case study 3, and respondent 4 for this case study 4. Okay, and then this is my list of case study, which is firstly Melaka Hospital and Melaka Hospital handled by Medivest. Second case study is Raja Perempuan Zainab II Hospital handled by Redecare. And then case study 3 Tengku Ampuan Rahimah Klan Hospital handled by Flora Sentosa. And lastly Selayang Hospital handled by Medical Apparatus Supplies. And my focusing is on risk management plan by all this company that handle the clinical waste. The case study be compared to recognize the similarities and difference between the case study based on interview season. Okay. Then the case study be compared and recognize the similarity and difference between the case study based on interview season. The first phase of risk management plan need to be noticed by service provider in Malaysia is to ensure that objective are agreed upon and understood by all stakeholders and determine the scope and level of detail required for the risk process in the risk management plan and driving by the recognized and strategy important of the situation at risk based on the interview conducted for objective 1. Respondent 1 and respondent 2 investigate the the background information to review objective and the risk management plan process aligned to current as well as a future goal. And then after investigating the background information, all the respondents agreed that service provider need to identify the potential of risk. Here, where the respondent need to dig into the consider all level of the knowability of known risk, unknowable risk. Suitable software can be help service provider in identifying the risk based on the semi-structured interview. The respondent use software like project manager software to help respondent identify potential of the risk. And then they estimate the impact and the probability of the happening. Once risk has been identified, the risk need to be analysed. All the respondents mentioned that the risk need to evaluate and assess the consequent impact and probability of each risk. In this step, respondents are going to review the qualitative and quantitative impact of the risk and then assign a likelihood score for the low and the high probability, and a risk impact score either low, medium and high. This show how dangerous certain risks and how urgent response need to be. The more complex their score, the more complex their method will be become. Okay, then they define the response. The respondent agree that after estimate the impact of the probability of happening, the respondent need to be define response. The respondent said that they need to plan their response to the possible risks such as use mitigation and contingency. Mitigation is a document of how the respondent will take action to lower the probability of the particular risk. There are 4 possible response to risks such as avoid to eliminate the threat, then transfer has offload the risk to third party. Mitigate is the reduce to probability or impact of the risk even and accept the risk means sometimes there is no other alternative that then can proceed with that and accept the risk. Okay, for the objective 2, based on the comparison of the case study, each facility manager has its own challenges that he need to face in a risk management plan in managing the clinical waste. Okay, firstly, lack of the knowledge. According to the semi-structured interview conducted, all the respondents agree that there is a lack of knowledge from the staff in the risk management plan. He said in process of identifying the potential of risk, the challenges occur because of lack of knowledge from the staff. So the process of risk management plan becomes slowly. Then lack of staff training. Training among staff is the important thing to make sure the process in the risk management plan runs smoothly. All the respondents agree that they have difficult in identifying the potential of risk because the staff was not skilled, especially in using the new software. Okay, then mismanagement and lack of handling. 3 respondent 1, respondent 2 and 3 agree that mismanagement is the challenge in the risk management plan. The respondent need to identify the potential of risk, know the level of the risk. But when the respondent miss an item in the identified of risk, the issue can cause risk like air pollution, risk infection because of the possibility of unintentional reuse of needle, and improper risk management has been occur. Okay, then lack of risk decision making. Based on the semi-structured interview, 3 out of the 4 respondents agree that they have difficult in risk decision making. Big risk decisions are being made with people are no incentive to make the right decision for the organisation. However, respondent 2 mentioned that the organisation from service provider need to develop structure so that the important risk based decisions are made by the right people. Those are who are accountable for the impact, either good or bad. And okay. Okay. And then for the objective 3, firstly, education and training. Objective 3 is the key factor of improvement in the risk management plan. And firstly is education and training. All the respondents agree that education and training can help improve risk management plan. To reach the qualified stage, the training must follow some of the following steps like need analysis, training implementation, learning objective development, and lesson plan. And then for the management, patient and family complaints, based on the semi-structured interview, only 1 out of the 4 respondents agree the management of patient and family complaint is one of the factor improvement in the risk management plan. Respondent 4 mentioned this factor can improve the risk management plan because service provider can take attention to the complaint from the patient and family about the risk as an improvement. And then contingency plan. One of only respondent 1 agree that by developing a contingency plan, the works can reach transfer to unexpected event. The faster organisation can get back up and running, the fewer damage, profit and revenues we take. The problem always occur anyway, so the role of the service provider is need to make sure the contingency plan is always prepared if anything happen. Then for the improvement based on failure, only 2 respondent 2 and respondent 3 agree that improvement based on the failure can help improve them to perform their duty better based on their experience. And then a systematic methodology for clinical waste management. Only respondent 1 agree that use the systematic methodology for clinical waste management can help him to improve the risk management plan. When the right method or way was used, the risk management plan was in good planning. The respondent was easy to identify the potential of risk and can estimate the impact of risk as well. When using the right system and have the complete data from the company, the process is identifying potential of risk much easier and automatically can reduce the impact of the risk. And then communication plan. Communication is crucial component is all steps of the risk management plan. Service provider and healthcare institution need to recognize the importance of the communication in managing clinical waste in healthcare in order to thrive. Through the interviews conducted, all 3 respondents agree that good communication can help them improve the risk management plan. And then strategy decision making. Respondent 4 agree that strategy decision making is one of the factor improvement in the risk management plan for the clinical waste management. Strategy decision making is a process to select the best alternative or rank that alternative for a specific risk management goal. Risk manager have to make a high stake decision based on practically unlimited information but limited time to analyze and organize the information. And lastly, strategic planning and continuous improvement. All the respondents agree that strategic planning can help them in the risk management plan. Continuous improvement thus it is necessary to periodically monitor and review the result of any new risk management plan system. The continuous improvement in the risk management plan guarantee that organizations are consistently positioned to adhere to the standard worldwide. But the process has to be locally appropriate, and the market practice and service delivery should be aligned with the current process within the country which are operating. Then as a summary, this is my as a micro case show similarity and difference between the case study based on interview season. Okay, last but not least, as a conclusion, I achieved my research objective based on my finding. Majority of the respondents have opinion on their way in managing the risk management plan for clinical waste. In order to improve risk management plan in clinical waste, apply in the risk intelligence to the service provider at all level perceive risk management can conduct themselves concerning risk. A lack of risk decision making should not be one of the challenges in handling risk management plan. When support from the top management can help the organisation develop a strategy that align with the company mission. And future study can elaborate more detail in process of risk management plan based on hospital perspective. That's all from me. Thank you. Assalamualaikum.